Hello friends, welcome to another session of KAPS Recalls discussion. Let's begin with today's first question. Question number 36. Which of the following is not used in the treatment of overactive bladder? The options are oxybutynin, mirabegron, botulinum toxin and lithium. So here the correct answer is option D, that is lithium. Among these options, lithium is not used in the treatment of overactive bladder. Medications that relax the bladder can be helpful for relieving symptoms of overactive bladder and reducing episodes of urge incontinence, which include anticholinergic medications and selective beta-3 adrenergic agonists. Oxybutynin, darifenacin, festrodin, solifenacin, tolterodin, and trospium are synthetic atropine-like drugs with antimuscarinic actions. These agents are used for the management of overactive bladder and urinary incontinence. Oxybutynin is also used in patients with neurogenic bladder. And then about mirabegron, it is a beta-3 agonist that relaxes the detrusor smooth muscle and increases the bladder capacity. It is also used for patients with overactive bladder. Then this Botox injection into the bladder is a well-established treatment for overactive bladder and urgency incontinence, including urgency incontinence associated with a neurological disease. It is usually used when behavioral and exercise therapies and medications have not been effective in treating symptoms. So next question. What happens when the gallbladder is removed? The options are fats and oils are not emulsified, bile production increases leading to improved fat digestion, the liver stops producing bile altogether, the risk of gallstones formation increases. So here the correct answer is option A, that is fats and oils are not emulsified. The main function of the bile is to emulsify the fats and oils. Okay, so the liver produces bile, a solution that helps you digest the fats. The gallbladder stores this bile. As the fatty food enters the upper portion of your small intestine, that is the duodenum, the gallbladder squeezes bile into the small intestine through the bile ducts. So if the gallbladder is removed, the fats and emulsified oils will not get emulsified. Question number 38. What is finasteride commonly used for? The options are erectile dysfunction, benign prostatic hyperplasia, hypertension, and type 2 diabetes. So here the correct answer is option B, that is benign prostatic hyperplasia. Finasteride is a 5-alpha reductase inhibitor prescribed for male pattern hair loss and benign prostatic hypertrophy. This enzyme, that is the 5-alpha reductase, is responsible for converting testosterone to the more active dihydrotestosterone. The dihydrotestosterone is an androgen that stimulates prostate growth. By reducing this dihydrotestosterone, the prostate shrinks and urine flow improves. This is how the finasteride is effective in BPH. Next question. Which antiepileptic medication is associated with the risk of causing sexual dysfunction in some patients? The options are carbamazepine, pregabalin, lamotrigine, and levetiracetam. So here the correct answer is option A, that is carbamazepine. In particular, liver enzyme-inducing antiepileptic drugs, for example, phenobarbital, phenytoin, and carbamazepine, can cause sexual dysfunction by decreasing bioactive testosterone, accelerating sexual hormone metabolism, and stimulating binding hormone proteins production. Question number 40. Which medication is known to cause thyrotoxicosis as a potential side effect? The options are ibuprofen, amiodarone, acetaminophen, and omeprazole. This ibuprofen is a non-steroidal anti-inflammatory drug. Amiodarone is a class 3 antiarrhythmic drug. Acetaminophen is also an NSAID. Omeprazole is a proton pump inhibitor. So in these options, the drug which is responsible for causing thyrotoxicosis is option B, that is amiodarone. Thyrotoxicosis is a medical condition caused by an excessive amount of thyroid hormones in the bloodstream. The main cause of thyrotoxicosis is hyperthyroidism, which is an overactivity of the thyroid gland, resulting in it producing excess levels of thyroid hormones. If the hyperthyroidism is due to an autoimmune cause, it is called Graves' disease. So the drugs mainly cause thyroid dysfunction include amiodarone, lithium, interferons and tyrosine kinase inhibitors. So with this question we have finished or we have completed today's recalls. Thank you for watching this video. Have a good day and let's see in the next video session.